the ASHP Research and Education Foundation, in partnership with the Cardinal Health Foundation, is proud to introduce the finalists and recipient of the 2008 Award for Excellence in Medication Use Safety. No other award recognizes the critical leadership role that pharmacists play in improving and promoting medication safety in hospitals and health systems in the United States. The first of our two finalists is Northwestern Memorial Hospital, located in Chicago, Illinois. In 2006, Northwestern determined that their initial medication reconciliation compliance was just 40%. A multidisciplinary team, supported by hospital leadership, created the MATCH initiative to weave medication reconciliation into all points of patient care. The goal was to improve and maintain medication consistency through a streamlined process that would involve all physicians, nurses, and pharmacists, and result in cohesive medication management. The MATCH initiative incorporated enhancements to the electronic medical record and included mandatory multidisciplinary training. It helped ensure that physicians were aware of medication histories prior to placing orders, that nurses and pharmacists validated medication histories against active orders, and that pharmacists participated as final points of reconciliation. Northwestern's MATCH program raised rates of medication reconciliation compliance above 90%. Medication reconciliation is an always practice and an integral part of clinicians' workflow at Northwestern. Richard M. Ross Heart Hospital at The Ohio State University Medical Center in Columbus, Ohio, is the second of our two finalists. This project was the result of a pharmacist-led multidisciplinary team that focused on the incidence and severity of bleeding associated with medication use during percutaneous coronary intervention, or PCI. An initial evaluation of bleeding and length of stay in patients receiving anticoagulation as adjunct therapy with PCI revealed a decrease in total bleeding and length of stay in patients who received bivalirudin versus those receiving glycoprotein 2B3A inhibitors. Practices and policies were revised, and cath lab staff, which included physicians, nurses, and pharmacists, received intensive educational training to safely incorporate bivalirudin as the preferred adjunct agent for PCI. Following this intervention, an evaluation was performed that included 389 patients. Total bleeding and length of stay were significantly less for patients who received bivalirudin versus a glycoprotein 2B3A inhibitor plus heparin. The initiative demonstrated a reduction in length of stay by approximately 50% in both treatment groups. This initiative significantly improved medication safety in patients requiring PCI. And now, let's meet the winner of the 2008 Award for Excellence in Medication Use Safety. Novant Health is a not-for-profit integrated healthcare system based in Winston-Salem, North Carolina. It serves 4 million people in 34 counties, reaching from Southern Virginia to Northern South Carolina.
When the SafeMed program was first proposed, we were evaluating all the reasons patients came back into the hospital, and adverse drug events were 17.9% of the patients were being readmitted due to adverse drug events.
Well, the system is really set up to immediately capture patients from the hospital that are at high risk for problems with their medications. Set up a system where the pharmacist can communicate both with the hospital and directly with the primary care physicians for those patients and help manage those issues. So there's immediate communication between the ambulatory and the hospital setting.
I was questioning some of my medications because I didn't know exactly how to take them. Some would be full glass of water, with food, without food, don't take it here, don't take it there. And this was a little bit complicated for me.
You've got physician champions, you have pharmacists, you have nurses, and a whole team of people that are integrated into the overall concept to provide better care for their patients and the families. Upon discharge of the hospital, the patient is given an updated list of all of their medications. You have callbacks from the pharmacist asking them, did they understand the medicines that they were given? And then the primary care physician understands and knows exactly what those medications were.
Part of what our organization tries to do is identify opportunities to help patients move from the inpatient to the outpatient arena and help them get to the right care at the right time, because that's often where we find that there are gaps in care.
Our original goals were to decrease adverse events, decrease admissions due to those adverse events. And what we've seen is a dramatic decrease in those admissions, from 17.9% down to 4%, as well as the fact that in patients that see those SafeMed pharmacists, they are half as likely to be readmitted in 30 days as patients who haven't.
Congratulations on receiving the 2008 Award for Excellence in Medication Use Safety.